What was it like getting into the trial of a experimental drug for hairy cell leukemia after that experience with the chemotherapy and the rituximab?
I was actually excited to get into a trial that had promised that I would get treatment and that would take care of the hairy cells. So I was very excited to get into the treatment and come to see you.
So your local doctor is the one who really found the trial and really steered you towards us.
Yes, my local hematologist in Delaware found the trial. He did whatever paperwork or prep work that needed to be done to get me into the trial, and I happened to qualify. So that was wonderful news when I had that appointment with him, and he told me that there was a trial and then I qualified to get into that trial.
Mm-hmm. And actually, it was probably a good news also that it wasn't too far away.
Exactly. It was only a 2-hour drive from home, and that was even a bonus.
Of course, terrible traffic, though, right? Okay. And so it only took about a month or two to get in, or did it take a lot longer?
It didn't take a very long. I don't remember it being a very long. I remember having the conversation with my hematologist, and I remember it being a fairly short period of time later where he pulled me back into the office and said he found a trial that I qualified for, and to deal with hairy cell leukemia.
And what was it like going to NIH for the first time and trying to navigate getting started? In other words, trying to find your way around. And
it was an experience. It's highly secure here, so the first time coming here and having to get out of my car and having the car searched and all the security procedures at the NIH is interesting. It's a large complex. So finding the places where I needed to go was a little tricky as well. So, but yeah, it was an experience.
And you found the nurses pretty helpful too.
They were absolutely helpful. Yes.
Yeah, the nurses are always great. We really appreciate their hard work. So how long did it take to get started on treatment? And what was it like, taking an experimental treatment? In other words, it's not the same as you don't just start the same day. You have to learn about the side effects and all that stuff. Was that sort of a new experience for you?
Well, the experience that I take away from the whole thing is I was a little concerned that I'm getting an experimental drug. What could this drug do? What other side effects are there with the drug? How effective it is? There was no history on it. So I was worried about those things, but I also I had confidence that this drug was going to take care of the hairy cell, and that was my primary focus.
Okay.
And I knew I was in good hands with you.
Okay. I guess what I remember is that you really, your labs looked okay. You didn't look like you had any major problems. The drug, of course, is called moxetumomab pasudotox. Back then, we might have called it HA22. Is that right?
Exactly. I knew it by HA22.
Right. And that HA22 actually stands for a high affinity type of agent for CD22. And the way that drug works is it has an antibody fragment on it that binds to CD22, which the hairy cells are loaded with. And so hairy cell is kind of a perfect target for this drug because it binds to the CD22 on the hairy cell. It goes inside and it has a toxin on it. And the toxin kills the cell. And because these hairy cells have a median of about 40,000 sites per cell of CD22, they're really optimal to be killed by the toxin. And although normal B cells have CD22 on them, and they may be killed as well, the cells that produce the normal B cells, the normal B lymphocytes, they don't have CD22 on them, so they can start making normal B cells, and usually within a month, the normal B cells are back up. But the hairy cells, they don't recover, at least in the patients who have complete remissions. And so that's really the beauty of the targeting of hairy cell with moxie. And we by the way, we call moxetumomab pasudotox moxie just because it's a shorter term. What was it like getting treated with moxie, and what were some of the side effects that you remember back then?
I don't remember any memorable side effects. I do remember all the water you made me drink and all the trips to the laboratory to get rid of all that water. I was never a water drinker before that, but I drank a lot of water during that treatment. So I did find the little drink enhancement, squirt a couple thing in, that helped me drink all the water that you wanted me to drink. But that's the main thing I remember from the treatment, other than I stayed here 8 days each treatment. Mm-hmm. But that was the main thing I remember. Hardly any side effects that I could remember.
So really not like rituximab.
No, absolutely not like rituximab.
Okay, all right. And this is very typical, what we hear from patients, that they really are surprised that it's sort of like getting water, really no immediate side effects. What we do though is we tell people to drink a lot of water, so this is really, really important, and this is something that we're trying to communicate with doctors now that the drug was approved last September, and people are using it. They don't have our experience, so we want to make sure that they know the safest way to give it. The drug can cause some kidney damage if patients are dehydrated. But if patients are well hydrated, then the drug should be well tolerated. We actually check to make sure that kidney function is good before we start. And that's one of the reasons why we checked your kidney function and you passed, your kidney function was okay. But if patient's kidney function is very poor, they probably would do better with a different drug.